Hereditary Hemorrhagic Telangiectasia. Definitions. Hereditary, which means genetically transmitted or transmittable from a parent. Hemorrhagic, which means pertaining to bleeding or the abnormal flow of blood. And telangiectasia, which is the abnormal condition of the dilatation of the capillaries that causes them to appear as a small red or purple clusters. These together make the name of the disease hereditary hemorrhagic telangiectasia, also known as HHT or Osler-Weber-Randus syndrome. This is an inherited disorder characterized by multiple malformations or abnormalities of various blood vessels, also known as vascular dysplasia, and it is also potentially resulting in bleeding, which means hemorrhaging. Application in medicine. As we all know, in the circulatory system, blood carries oxygen from the lungs and is normally pumped to the heart from the heart to the arteries with a high pressure. This allows the blood to make its way through the arteries and get to the small vessels, which are arterioles and capillaries, that supply oxygen to their body tissues. These capillaries' pressure is much lower. In hereditary hemorrhagic telangiectasia, some arterial vessels flow directly into veins rather than into capillaries. These abnormalities are called arteriovenous malformations. When they occur in vessels near the surface of the skin, where they are visible as red markings, they are known as telangiectasias. As we see in the picture A, in the inside of the mouth, we can see the vessels. Also, the extra pressure tends to strain and enlarge these blood vessels and may result in compression or irritation of adjacent tissues and frequent episodes of severe bleeding, known as hemorrhage. These nosebleeds are very common in people with hereditary hemorrhagic telangiectasia, and more serious problems may arise from hemorrhages in the brain, liver, lungs, or other organs. The blood moves from the arteries at high pressure into the thinner wall, less elastic veins, which causes this inflammation. Symptoms. The symptoms vary a lot from person to person. The differences in these symptoms express the specific gene that is muted. In many patients, the first appearance of symptom of HHT are nosebleeds, also known as epistaxis. Recurrent nosebleeds occur in most affected individuals. These nosebleeds occur because of the formation of small red lesions, as we saw in the video before, in the mucous membranes, and it occurs when capillaries fail to develop between arterioles and venules. The tongue, lips, face, ears, and fingers are also other areas most affected. It also occurs in the gastrointestinal tract between 25 and 30%, and in additional organs including the lungs, brain, spinal cord, and liver. The affected individuals with gastrointestinal bleeding rarely have dark, bloody stools that are called melena or episodes of bloody vomit, which is hematemesis.
Doing well.
Developmental biologist Beth Roman is working to pinpoint the cause of HHT. Inside her genetics lab, Professor Roman is studying zebrafish, which develop their veins and arteries the same way mammals do.
This is the shunt, the vascular shunt that's formed up here.
Professor Roman has identified abnormal cells in the lining of the blood vessels in HHT lesions, a first step toward developing a treatment.
I think this disease is often overlooked, and it's absolutely underdiagnosed.
Professor Roman says for now it's crucial to identify HHT patients and monitor critical areas in the lung, liver, and bone.
My infant is going for an MRI of her brain on Sunday because she's at high risk for a brain aneurysm. And part of me thinks, like, this is a nightmare. But the other part of me feels like maybe Charlotte might save somebody else's life.
The entire family has since had genetic testing. Lindsay recently learned she, her sister, and her mother have the condition. Lindsay's baby Hattie may have a malformation in her brain. In the meantime, Charlotte has regained her ability to walk with a leg brace and continues with physical therapy.
Pros and cons. Pros. It can be treated. The treatment of HHT is directed at specific symptoms present in each individual, as well as surveillance for undiagnosed MAVMS. The Cure HHT Foundation posted recommendations on the website that is written in there, www.hht.org. that includes brain MRI procedures to screen for several AVM upon diagnosis. Nosebleeds can often be temporarily relieved with lubrication or the application of pressure to the affected areas. These more aggressive surgical therapies are possible when the patient is severely anemic from nasal blood loss. Several experimental medical therapies are being studied. Cons. Most individuals with HHT develop arteriovenous malformations, which is AVMS. These are direct connections between blood vessels or larger caliber than in telangiectasias. Affect the lungs, brain, spinal cord, and liver. PAVMS may result as fatigue, difficulty breathing, which is called dyspnea, episodes of coughing up of blood, headaches, abnormal bluish discoloration of the skin, and or abnormality increased levels of red cells called polycythemia. And also serious neurological complications may occur. Issue in Ecuador. HHT, or Hereditary Hemorrhagic Telangiectasia, affects males and females in equal numbers. Symptoms can occur at any age. The disorder is estimated to occur in at least 1 per 5.000 people. HHT is known to be underdiagnosed, and this makes it difficult to determine the true frequency of HHT in the general population. According to Dr. Francisco Tama Viteri, who made a research between August and July, there is one affected person between a lot of individuals. The 95% of the affected present recurrent epistaxis, where it appears at 12 years old and show a progressive increment of nose bleeding in frequency and severity. This is a chart of the past symptoms of HHT and the actual ones. In the 19th century, the only symptoms and diagnoses we had were telangiectasia, nosebleeds, gastrointestinal bleeding, which was connected with iron deficiency and anemia. Now, we see 90% of nosebleeds, 80% of affected skin, lips, and mouth telangiectasia, 30% of pulmonary AVMS, less than 30% hepatic AVMS, 15% of gastrointestinal bleeds, 10% of cerebral AVMS, and 1% of cases of spinal AVMS. Conclusion. This disease is associated with different complications, being the A and B responsible of morbid and mortality of these patients due to digestive hemorrhage, pulmonary and intracranial bleeding. When the disease is not diagnosed and treated at time, it can appear cases of secondary anemia. The prognostic is unknown, but with a diagnosis and an early treatment is able to improve the patient's quality of life and achieve a similar lifestyle as the rest of the people in general.